Let's talk about itchy ears. If you're thinking to yourself right now, I have a deep itch within my ears and it's killing me, well, you have found the right video, because we are going to learn all about itchy ear treatment. We're going to learn how to stop those itchy ears, and we're going to learn about the best ear drops and things to use to stop itchy ears. So let's begin. So welcome to my channel. If you haven't been here before, we talk about everything healthcare, everything medical to keep you healthy and happy. Also, if you find any of the information helpful in this video, I would really appreciate it if you slap that like button, give it a like, because it's going to help me, it's going to help the video, it's going to help the video grow so more and more people can view it. So next thing I'm going to say is, please don't forget, in the description as well, we do chapter the entire video, so if you want to find any specific piece of information, please feel free to click it. However, as I would always say, I'd always advise you to watch the entire video, that way you're going to become an itchy ear treatment pro. Let's begin. Okay, so before I started filming this video, I thought to myself, what's the best way to present this information? Because there are loads of different reasons for itchy ears, and the treatment obviously differs depending on what type of itchy ear you're having. So I thought to myself, probably the best way to do it is we mix them all together, talk about each different type of itchy ear and its treatments, and then work our way through them. Now, before we begin, please do remember, I understand itchy ears are super itchy, okay? They can be caused by many different reasons, but please remember, try and stay away from itching them, because it's just going to make things worse. It's just going to cause this feedback loop that makes things work, and you're going to keep itching them. And also, please remember, if you are itching inside your ear canal, please, I'm going to say please again, please do not put anything in your ears. Don't put earbuds in your ears, don't put anything in your ears, okay? Because you're going to be at a high risk of rupturing your eardrum. And believe me, it does happen. We see patients day in, day out who have ruptured their eardrums, and this can be very problematic, and it can make things so difficult to treat if you rupture your eardrums. So please stay away from the earbuds and don't put anything in there. Okay, so let's start with scenario number one. Probably one of the most common reasons for an itchy ear is an ear infection. And ear infections can be caused by bacteria, viruses, and fungi, okay? All three of them can cause it. You can be at a higher risk of getting an ear infection, for example, if you've just had a cold, if you just had the flu, okay? All of these can increase your risk of having an ear infection post or pre or during having those illnesses, okay? Also, with regards to a fungal infection, for example, usually the symptoms persist of, itchy ears, if it's flaking as well around it, possibly behind the earlobe as well, inside the ear. Sometimes you get flaking, you might even get a bit of smelly discharge, a bit of oozing. Sometimes that happens. That can also happen with bacterial infections and viral infections, actually. They all have very similar symptoms, to be quite honest with you. And the best way for us to check an ear infection is to get the otoscope. As you can see here, we get the otoscope, have a look in the ear, okay, and see exactly what's going on. We always like to look in both ears, that way we can compare and contrast, because if you're telling me your right ear is hurting, okay, I'm gonna look in your left ear as well, because then I can look at what your normal ear looks like and compare it to your bad ear, okay? That's why we always look at both ears. But the reason I brought the otoscope out and stretched it this far is to tell you the most important thing is, if you feel like you have an ear infection, if you have them sort of symptoms, if it's inflamed around the ear, if it's red, if it's itchy, if it's flaky, if it's getting worse, and if you've just had a cold or flu or anything like that, for example, you need to speak to your healthcare professional. That is the most important thing for an ear infection causing dry, itchy ears, okay? The other stuff we're going to talk about, you don't need to speak to your healthcare professional usually, but this one is particularly important that you do, because they're going to have to look into it and see exactly what they need to do for it. So in terms of treatments for an ear infection, we have loads of things to our disposal that we can prescribe you. For example, there's loads of drops that contain antifungals in them, or they contain antibacterials in them, or they contain a steroid, or they contain all three, for example, that you can use in your ear. Another thing as well that we sometimes commonly prescribe is, for example, an antifungal cream, especially if you've got an infection around the back of your earlobes, any dryness there, any itching, any build-up of dry skin that's building up there. Sometimes that can be a sign of a fungal infection, and sometimes we prescribe an antifungal cream for it. You can also speak to your pharmacist for some of these creams and some of these drops as well. They might be able to sell you them over the counter. Obviously, they're going to ask a few questions to make sure that you're safe and suitable to use it, but this depends on wherever you are in the world. The rules and regulations might be different. Another thing that I sometimes prescribe for patients, especially if they're getting recurrent fungal infections around the ears and they're getting dandruff as well, because they're so closely linked, is sometimes I prescribe them a ketoconazole shampoo that they can use on their scalp and sort of use around the ear and then wash it off. That again has that effect of killing the fungus and then not returning as well. So this can be really effective, and it might be something that is worth mentioning to your healthcare professional as well. Now moving on to scenario 2. Scenario 2 is probably the second most common reason, and it's just called dry ears. And we can get dry ears for many different reasons. Some people produce dry earwax, for example, which puts them at higher risk of getting dry ear canals and it being dry inside and around it and becoming itchy as a result of it. Some people are excessively removing earwax. Remember, the whole point of earwax is 1, to prevent any foreign objects from going in, and 2, to keep the ear canal nice and moist and hydrated, okay? Now if you're constantly removing it by using an earbud or, I don't know, getting it syringed or cleaned all the time, you're gonna put yourself at a higher risk of dry ears, okay? And when they're dry, they become itchy and uncomfortable, okay? So if this is your scenario, we're gonna talk about what you need to do about it next. So in terms of treating dry ears, it's very simple. The first thing I'd recommend is olive oil. And when I say olive oil, I don't mean the stuff that you can buy from the supermarket, the stuff that you cook with, the stuff that comes in nice fancy bottles that we cook with or dress our salads with. No, it has to be the ones that you buy from the chemist. It has to be the ones that are sort of approved for medicinal use that can be put in the ears, okay? They come with a dropper and they're filtered, like they're filtered low just to make sure they've got no particles in them so it's safe to put in your ear, okay? That's the reason why I'm saying don't use the cooking stuff. And I've had loads of questions, loads of comments on the earwax video that we made, I don't know, 6 months or a year ago. It's had over 1 million, 1.5 million views. It's helping loads of people, but this is one of the most common questions we get on it. So I'm making it clear now, it has to be the one that you buy from the chemist. Don't use the cooking oil at home. That's the worst thing you can possibly do. It's just gonna put you at higher risk of getting infections in the future. So, in terms of using it, go and get your olive oil from the chemist. Then, I'd recommend you use maybe 1 drop a day or every other day. It's completely fine. To begin with, if it's very dry, you can use it twice a day and then just slowly reduce the dose. At the end of the day, it's only olive oil. It's just gonna keep it moisturized in the area. And when you put it in, you want to press the ear a few times like so. That way your ear canal will sort of press in and it will just spread the olive oil nicely through the ear canal, making sure it helps it more. You can also use a normal moisturizing cream around the ear or inside just over here as well if it's dry. So that is also an important thing to use. Some people find petroleum jelly quite helpful as well behind the earlobes, just because it stays there for longer and helps to keep the area hydrated. Obviously, you've checked with your healthcare professional that it's not a bacterial, fungal or viral infection, it's just dry ears, and all of these things are fine to do. Okay, so moving on to scenario 3, which is all about hearing aids. Certain people who have hearing aids can get dry ears as a result of it. This can usually be due to the pressure and the friction that it's causing, or if they're just poorly fitted. All of these can cause dry, itchy ears. Now, in terms of what to do if you do have a hearing aid, first of all, I'd highly advise you to speak to your healthcare professional or the place where you get your hearing aids. Make them aware that you're having trouble with it, just so they can check the fittings to make sure that the fittings are correct. Sometimes it's mainly usually due to a poor fitting hearing aid that's causing it. Another thing that you can do though is dab a little bit of olive oil, for example, around the area in the ear, not in the ear canal, but within the ear sort of area. Do this when you're not wearing your hearing aids though. You don't want them to get oily, so probably best to do it at night when you take your hearing aids out. Dab a little bit of olive oil on some cotton wool and just spread it around the area, and then just leave it there in the morning, just wipe it off. Like I said, you don't want to get it on your hearing aid, it's probably going to break it and just cause problems, okay? So make sure you wipe it all clean before you put your hearing aid in again. Okay, so the next scenario I want to talk about is earwax blockage. Look, we all produce earwax. Some people produce more than others, okay? And when the earwax gets a bit too much and a bit too thick, it can cause blockage of the area, and then it leads to dead skin being left there, dead hairs being left there, and all this can potentially then cause some inflammation, which can then cause the dry ears, okay? So, one of the most important things is, 1, don't use earbuds, okay? Like I said, do not use earbuds in ears, don't use ear candles or any of the products out there that suck it or anything like that. Don't use any of them. You're just at risk of rupturing your eardrum. And like I said, it does happen. I see patients all the time who've got ruptured eardrums, because all it takes is you put it a little too deep and boop, it's gone through, okay? Your eardrum is very, very thin, and it's not like your skin that can basically resist something prodding into it. If you go in too deep, it's gonna go through, and it is a pain. It is really difficult for patients when their eardrum bursts, okay? So don't put anything in there. Also, just out of a note, we can tell if you use earbuds, okay? I've had patients ask me this before. Can you tell if I've used earbuds? Yes, we can, okay? When we look in an ear with the otoscope, we can tell from the way that the wax is deposited in the ear if you put earbuds in or if you haven't been touching it, okay? They look very different, okay? A natural ear that hasn't been touched compared to an ear that's being cleaned all the time. Now, let's move on to treatments. So in terms of treatment for earwax blockage, the first thing we're gonna go to again is olive oil. Olive oil is our go-to ear drop, okay? It's natural, it's nice to use, it doesn't cause any problems. There are other ear drops as well. So for example, there's peroxide ones, there's sodium bicarbonate ones, but all of them do cause dryness to the ear as well, okay? Whereas olive oil doesn't cause that dryness to the ear canal. So that's the main problem that I have with the ear drops, is that when you use them, they cause a real massive dryness to the ear canal. Now, our ear canal naturally likes to be moist because when it's moist, it doesn't cause all these itchiness and all the problems that we get. So you're gonna use olive oil. Like I said in my previous video, if you haven't seen that video on how to treat earwax, I'd probably say go and watch that because I don't want to make this video too long. So I'll leave a link to that up here and in the description below. So watch that on how to use olive oil properly in terms of treating earwax and when to get medical help for it as well, okay? It's important that we're treating it because if we let it build up, it can put us at risk of infections and then causing all the other issues as well with it. So the next scenario that I want to discuss are swimmer's ears, okay? Swimmer's ears is basically what we call for otitis externa, and this is when water goes into our ear canal and it gets trapped in there. And when it's trapped, it puts us at higher risk of bacterial infections, fungal infections, all the types of infections that then cause the itchiness and the dryness. Now, when you have swimmer's ear, for example, it's quite common as well to get facial pain. You might get a bit of vertigo, a bit of dizziness. These are all quite common with it as well because this whole area is responsible for our balance. So it can cause a lot of other symptoms as well. Now, in terms of treating swimmer's ear, usually it goes away on its own when the water just comes out on its own. But in terms of treating that itchiness, we're not going to go to olive oil for this, but there are products out there that you can buy over the counter that contain acetic acid. And for those of you who know, acetic acid is what we use in vinegar. So vinegar has acetic acid in it, it gives it that smell, okay, of vinegar that we all know so well. So when you put this spray in, you are going to smell vinegar, okay? That's a very well-known smell that we're all used to. However, please remember, this doesn't mean go and buy vinegar and put it in your ear. Please do not do that whatsoever. It has to be the medicinal product of acetic acid, which is a medical grade, okay? So the acetic acid sprays can be really, really helpful for reducing that itchiness and potentially reducing the chance of it becoming infected. However, if it does become infected, you are going to need to speak to your healthcare professional. In terms of infections, we're talking about if the pain is getting worse, if the itchiness is getting worse, if it's becoming red, if there's any discharge, you know, anything like that, if it's spreading, if you feel like it's spreading it towards your mouth and face as well, all of these can be a sign that the infection is getting worse and you need to speak to your healthcare professional. So please remember that. Okay, and the final scenario is patients who have hay fever and eczema and other skin conditions, okay? Some of these kinds of patients do often get more itchy ears and symptoms like that around the ears. So I do have quite a few videos on these topics already, on hay fever and allergies and things like that. I'm gonna leave it up here, and also on eczema and what you can do about it as well, which again I'm gonna leave up here. These are quite common, and if you do have these sort of conditions, it is worth speaking to a healthcare professional about in terms of treatments because it might need stronger, more aggressive stuff. Okay, so we're now done with scenarios and treatments. The next thing I want to talk about, which is something that I'm really interested about, is preventative stuff. So what you can do to prevent yourself from getting itchy ears in the first place, because there's loads of things that we can do that are going to help. So let's begin. Okay, so tip number one is all about drying your ears. Look, you need to make sure that when you come out of the shower or the bath or the swimming pool or whatever, you are drying your ears nicely, okay? So make sure you get your towel, rubbing into it nicely, okay? You don't need to rub harshly, but just getting into every single bit, or just get a clean tissue and rub in and around it. Don't put it deep into your ear at all, anything like that. Just rub in and around it and behind the earlobe and everything so it's nice and dry. This is really going to help at preventing you from getting those dry, itchy ears. Now, moving on to tip number two, this is something that I really like to tell patients to do, and like I said earlier, it's all about olive oil. Look, if you're someone who always has dry, itchy ears and it's not caused by any infections or anything like that, or if you produce a lot of earwax, we need to look at prophylactically using olive oil. So, like I said, using one drop every other day or once you come out of the shower or anything like that can really, really help keep the area moist and prevent you from getting those dry, itchy ears in the first place. And this can be really, really helpful for a lot of patients. Now moving on to tip number 3, if you're someone who always seems to get water stuck in their ears, even after they come out of the shower, for example, not even from swimming, look at investing in some earplugs, okay? Getting some earplugs and popping them in before you go for a shower or before you go swimming can make a massive difference. It's really gonna help reduce the chance of getting those dry, itchy ears. And moving on to the final tip, this may not apply to a lot of people, but if you're wearing any earrings, look at potentially not wearing them for a while and see if that improves the symptoms. Certain patients are allergic to the metals in certain earrings, which then cause the itchiness. So give it a go, trying it without the earrings for a bit and see if that improves your symptoms at all. Now with every video, I always go through scenarios where you should speak to your healthcare professional. In terms of dry, itchy ears, the things that we need to look out for is 1, any bleeding or discharge from the ears, you need to speak to your healthcare professional. If you're having any vertigo, so any dizziness, anything like that, speak to your healthcare professional. And if you've had any loss of hearing, any change in hearing at all, anything like that, you need to speak to your healthcare professional, okay? And if you feel like the symptoms are getting worse and they're not improving again, speak to your healthcare professional. It's super important that you're aware of this and make sure you speak to them because your health is the most important thing. So it looks like we've come to the end of this week's video. I really hope that you found this information helpful. You're now a bit of a dry ear, itchy ear pro. So let us know what you found helpful. Leave a comment below. And if you've got any of your own tips as well, please leave a comment below because I'd love to read it. And I'm sure everyone watching this video would love to as well. As I always say at the end of every single video, always remember that you're awesome and I will see you next week. Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos.